Hello and welcome to the CAPE training program. My name is John Leatherman. I'm a professor in the Department of Agricultural Economics at Kansas State University and a Cooperative Extension Service outreach specialist with K-State Research and Extension. I have over 30 years experience working as a rural community development specialist. This is the first of 3 videos introducing the CAPE training program. CAPE is short for Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. Development of this training program and related activities was sponsored by the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services, the National Institute of Food and Agriculture and the U.S. Department of Agriculture, and the USDA network of regional rural development centers. The purpose of this video is to provide a brief overview of the CAPE training program and what it is intended to accomplish. Many of the problems we face in communities are complex and difficult to fix. We may be dealing with problems of economic decline, population outmigration, public health, housing, or drug abuse. None of these problems is easily addressed, and there are no universal solutions. So if we want to improve the situation, what can we do? In my experience, no one will come into our communities and fix these problems for us. Yes, state and federal governments can and do help with policies and aid programs, but what they can do is limited. I've learned that we need to help ourselves. Many of these problems are bigger than what any single entity can solve. With a problem like the current opioid crisis, the police can't fix it alone, the health department can't do it alone, local government can't do it alone. I've learned that the most effective local self-help solutions come from a coalition of entities. Coalitions can coordinate their efforts and collaborate with one another, with each entity contributing to improving the situation. Coalition formation is considered an evidence-based approach to combating community problems relating to mental health and substance abuse. The CAPE program has several educational objectives. The first is to enhance behavioral health literacy. To do so, we have incorporated the Mental Health First Aid Training Program as part of our CAPE training program. Mental Health First Aid deals with behavioral health generally, but a primary focus of this training will be for substance abuse disorders. Mental Health First Aid training is available in most states or is reasonably accessible from almost anywhere. The second CAPE objective is to encourage the creation of community coalitions to address local behavioral health concerns, if such a group doesn't already exist in the communities you serve. Coalition formation is among the most effective ways to combat challenges such as the opioid epidemic. We'll address this as part of our video training and webinar meetings. The third objective of the CAPE program is to have you begin the process of creating a strategic community action plan to address your community's behavioral health challenges. Our assumption is that many of you viewing this will want to focus on the opioid problem. This also will be addressed as part of our video and webinar training. While you may need to solicit additional input from your community partners, our intent is to equip you with the knowledge needed to create an effective action plan. Our focus in this training isn't how the opioid crisis arose or who to blame. If you'd like to learn more about the background of the problem, you'll find excellent webinars on the North Central Regional Center for Rural Development archive of webinars. Our focus instead is, now that we have this problem, what can we do about it? We're taking an adult education learning approach that incorporates a series of video lectures and self-study resources that cover the planning and implementation of a community-scale initiative. Once again, when dealing with complex community problems, we need a community-wide effort to improve the situation. The video lectures and study resources can work as a standalone training on community capacity building within the context of dealing with mental health and substance abuse. All of these resources are available on the CAPE website. To strengthen understanding of substance abuse, we have a 1-day-long in-person training to offer the Mental Health First Aid Workshop. All of our other meetings will be webinar discussions. We will offer 5 webinars to discuss various topics of our larger discussion. The outcome on your behalf will be the development of a draft strategic community action plan to address your most pressing behavioral health challenges. For many of you, that will be the opioid abuse problem. This gives you an overview of the content of the training. Most of what we'll discuss is organizing and initiating effective community action. We also want everyone to have a basic level of behavioral health literacy. We presume you will collaborate with other health and mental health professionals. Frequently, healthcare providers know about healthcare, but they may not be expert in community organization. That part is often better suited to university extension or other community outreach organizations. To begin, what do we mean when we're talking about behavioral health? Behavioral health refers to 2 basic types of human problems. The first is mental illness, such as depression, schizophrenia, mental or physical abuse, eating disorders, or self-harm behavior. The second is substance abuse generally. This includes illegal drug use, prescription drug abuse, alcohol abuse, tobacco or nicotine use, and the like. Behavioral health challenges can relate to one, the other, or both types of problems. CAPE training is intended to inspire community action in relation to all of these problems. In this training series, I'll emphasize the opioid epidemic that is currently ravaging many communities. CAPE training was originally designed targeting university extension county educators because these individuals frequently serve as the catalyst for major community projects, particularly in rural communities. But it isn't intended exclusively for extension. We have included others who are concerned about and involved with behavioral health in their communities. Probably the 2 things to emphasize is that it has to start with someone, and that someone can't do it alone. If we're dealing with behavioral health generally and opioid abuse specifically, all of these entities can have a role. Some obviously have a greater role than others. The more we can involve all of these groups, the more we can accomplish. Why are we promoting greater involvement by University Extension Network? After all, very few extension educators have had training in health or behavioral health. Well, first, behavioral health is a big problem. If we stop and think about it, probably every one of us has been touched by a behavioral health challenge, either directly or indirectly. Within our families, social networks, or communities, we've all seen such things as alcohol and drug abuse, depression and suicide, or violence and abuse. My background isn't mental health either. But as I look around, see the news, and think about it, I ask myself, what do I do that's more important? The Extension Network is ubiquitous. It exists in every state and covers just about every county. Extension agents are typically well integrated into the communities they serve and know and interact with many community leaders. Many extension agents have experience in trying to organize bigger community projects and events. Most of their professional efforts are focused on achieving broad community goals that make the community a better place. Our thinking with CAPE is that by working to enhance behavioral health literacy and helping people to realize there is nothing difficult or shameful in talking about these issues, we can create an environment for more positive and effective community response. Our learning objective on your behalf is to enhance your capacity to deal with behavioral health issues. It begins by enhancing your behavioral health awareness and literacy. We want you to be able to recognize a behavioral health problem when you see it and to know what to do to be helpful. We want you to be able to identify the range of behavioral health services and providers in your community. Further, we want you to feel comfortable talking about behavioral health issues and challenges with the healthcare professionals that deal with these problems. Finally, we would hope that at the completion of this training, that you would have a greater capacity to address community-scale challenges, regardless of the specific focus. Here is what we are asking of you. First, we want you to be a full participant in all of the sessions and discussions. We want you to watch the training videos and do some amount of self-study. We are going to ask you to complete 1 or 2 planning exercises depending on the communities you serve. Finally, we hope to encourage you to do something to help your community deal with the challenges that it's facing. Participants are not expected to become mental health experts, to diagnose people they encounter, to make behavioral health your major focus, to solve community behavioral health problems or influence local mental health and drug use trends. We do not want you to place yourself in a dangerous situation. If you find yourself feeling threatened or afraid, my best advice is to remove yourself from the situation immediately. We are only encouraging you to try to be part of the solution. We have 2 more short introductory videos. The next video looks more closely at the mental health first aid training program, and our 3rd introductory video provides an overview of the CAPE Community Action Planning process. That will lead to our first formal webinar where I'll try to answer any questions you may have and hopefully secure your buy-in to the program. There have been many people who have helped me in the development of this program, and they have my sincere thanks. Here is my contact information and contact information for Mark Skidmore and Rosa Solas at the North Central Regional Center for Rural Development. You can also learn more about CAPE on the internet at www.healthbench.info. Thank you for watching.